thing. It's more a test of general scapular and glenohumeral motion, right? So a way to screen a person is, instead of having to take all the motions, you can do what's called an Aplys scratch. It's 3 positions, and really what you're doing is checking bilateral motion. So position number 1 is just touching your opposite shoulder. And then once they do that, you're just seeing their quality of movement and how far they go, and then the other shoulder. So again, a positive sign would be if I can do this, but then I can only do this. Obviously on this side I have drastic reduction in horizontal adduction as compared to this side. So it might just focus me on where I need to stretch, okay? What motions I need to look at. So that's number 1. Number 2 is over your head. And we're reaching toward our spinous processes. So we're really trying to make them reach right into the center of their back. And again, we can keep a spot and then relax and then go the other side to measure the difference. Again, the book says there could be slight difference on your dominant arm with this. Again, you have a little bit more muscle mass on your dominant side, maybe a little bit less flexible. It doesn't go on to say exactly how much. Couple 3 inches is probably reasonable. 8, 10 inches is not. If you'd ask me about 4, I don't know. It kind of depends on if they have any pathology there. It's probably not totally inaccurate. All right, so there's not a given guide for that. So that's number 2. Number 3 is reaching up behind your back like this. Okay, again, right to the spine of the scapula. That's important to us. And again, you can either identify the spine that they move to, right? So say it's T5, T7, T12, or you can measure the difference, right, between the thumb markings. Either way you want to go about doing that. The key here is that they're coming toward the spine. What a person will do after surgery or after injury is they'll do a little bit of this. I'm exaggerating a little bit there, but that's clearly elbow flexion, right? That's not the same as this. So if we're doing that cane exercise, where we go backwards and where we go up, we need them to get their hands close. So this is going to be way worse than this in terms of their motion. So my point is, if they do the Aplys scratch, we don't want them to do this. We want them to do this, right, into the spine of the scapula.
What's that?
Into the spine. What's that?
Is that a rotator cuff?
That is not rotator cuff. That is motion, right? It assesses your ability to equally move glenohumeral and scapular motion. So it's kind of a screening test for total motion, right? I will say this is technically, you will kind of see with internal rotation some pain, and that's kind of like an impingement sign, but that's not how they're calling this test to be a sign of.
Well,
okay?
it just kind of looked like the rhomboid test, like when you
So the rhomboid, or the lift-off test, if you remember that. But again, we're not lifting off. We're coming up. So it's not lifting off, which would be if we lift off this way or if we squeeze back that way, it's rhomboid or subscapularis. It's more a motion. Can I just get there? So there's no lift off to it. All right? Good? Understand?
Yeah.